Assalamualaikum and hi. In this video, we will be talking about Gerd and the factors that causes illness and also how changing a certain lifestyle can minimize the risk of getting this illness. Before we start with our presentation, let us introduce ourselves. My name is Nurizati binti Syara Azhar.
Assalamualaikum warahmatullahi wabarakatuh. And hi, my name is Naaz Rashikin binti Ahmad.
My name is Nurul Izzah Nadira binti Muhammad Zamrizan.
My name is Bushra Hanal binti Amira Mizan.
Hi, Assalamualaikum. My name is Nur Zulaika Najwa binti Johani.
Hello there. In this video, you guys will learn and more understand about GERD, the causes, the GERD effects, and the way to prevent this chronic condition. The introduction of GERD. GERD or gastroesophageal reflux disease is a digestive disorder that affects the ring of muscle between esophagus and stomach. This ring is called the lower esophageal sphincter, LES. Normally, LES acts as a valve allowing food and liquids into the stomach while preventing the backward flow of the stomach acid. In individuals with GERD, the LES is weakened or relaxing inappropriately, allowing stomach acid to flow back into the esophagus. This repeated exposure to stomach acid can irritate and damage the esophageal lining, leading to various symptoms. So you will see in the picture the difference between healthy stomach and the stomach with GERD.
There are three factors to someone can get GERD. Firstly, people who are obese or overweight, they tend to have a GERD when they're putting a pressure on their abdomen. Secondly, GERD is known as a commonly happen among pregnant moms due to abdominal pressure from their growing uterus. Lastly, when someone has gastroparesis, the chances to get GERD are high because of the food that's staying longer inside their stomach.
How does GERD affect you? If the GERD left untreated, it can cause a heartburn. Heartburn is a burning sensation in the chest. It happens due to the acid stomach irritating the esophagus. GERD can also cause a chest pain that may be mistaken for a heart-related issue. Inflammation and damage to the esophagus can result in difficulties swallowing that known as dysphagia. Some people with GERD have a chronic cough. It happens due to stomach acid irritating the airways. People with GERD also have a sleeping disturbance. It because the symptoms become more worse when lying down. It can affect sleeping quality and leading to insomnia. Lastly, GERD can result in several serious complications, example, esophagitis and Barrett's esophagus. Esophagitis may also lead to gastrointestinal bleeding.
There are a few ways to prevent GERD. First is by maintaining a moderate weight. Obesity in general is associated with greater chances of getting GERD due to the greater pressure within the abdominal cavity. This is because if you have excess belly fat, the pressure in your abdomen may become so high that the lower esophageal sphincter gets pushed upward away from the support of the diaphragm. Next is by reviewing your medications. There are numbers of medications that will lead to the increased risk of getting GERD, such as some antibiotics, certain asthma medications, and also sedatives and painkillers. The third one is by quit smoking, if you are a smoker. This is because some studies have found that nicotine can relax the muscle of the LES and can also interfere with your saliva's ability to clear out the acid out of the esophagus. The fourth one is eating dinner earlier. You should try to eat your dinner at least a few hours before going to bed. This is because research shows that going to bed with undigested food Particularly if you've eaten a heavy meal can worsen your symptoms at night. Eating close to bedtime may worsen acid reflux symptoms at night. The fifth one is you should avoid any food that causes reflux. Certain foods that causes reflux are fatty foods, spicy foods, chocolates, onion, coffee, carbonated beverages, acidic foods like tomatoes and citrus, and also meat. Last but not least is by sleeping on your left side. Research shows that lying on your left side will decrease the risk of getting GERD. According to one review, lying on your left side will decrease the acid exposure in the esophagus by up to 71%. Although the reason is not entirely clear, it can be explained by the anatomy of the esophagus. The esophagus enters the right side of the stomach, so sleeping on the left side will keep the acid away from the lower esophageal sphincter. The sphincter is normally responsible for keeping acid and your undigested food from coming back up to your throat. But different things can cause this to malfunction, such as your sleeping position.
Left unstraightened, GERD can result in several serious complications, including esophagitis and buried esophagus. Esophagitis can vary widely in several, with several cases resulting in extensive erosion, ulceration, and narrowing of the esophagus. Esophagitis may also lead to gastrointestinal bleeding.